Now civil rights leader Wade Henderson. He gave a keynote speech Saturday at a healthcare conference hosted by Families USA. Mr. Henderson heads the Leadership Conference on Civil Rights. This is about 25 minutes.
Good afternoon. All right. Just one quick announcement. As soon as this session is over, the conference is over, the Herndon Alliance is having its annual meeting right across the hall in the East Room. Bob Crittenden will be leading that meeting, and so all of you are welcome, right? I have a great pleasure to introduce a real friend as our closing speaker of this year's Health Action Conference. Now, this individual, Wade Henderson, if ever there's a person in this town who's an institution, it's Wade Henderson. He is as terrific a leader and coalition builder as anybody in this town. And he's been running all these organizations with these alphabet names. He is currently the president and CEO of the Leadership Conference on Civil Rights. Many of us know it as LCCR. For the few of you in the room who don't know about the Leadership Conference, the Leadership Conference is the nation's premier civil and human rights coalition. Wade's work primarily focuses on civil rights enforcement, voting rights, public education reform, fair housing policy, immigration policy reform. And we're going to be here about a half hour before Wade gets on. Media and telecommunications policy, economic and political empowerment of people of color, women, persons of disabilities, and the poor. Under his leadership, the Leadership Conference has become the nation's most effective defender of affirmative action policy and one of the strongest advocates for passage of the Hate Crimes Prevention Act. You can applaud, what the heck? With Wade's leadership, the Leadership Conference is playing an increasing and crucial role in health care. Prior to taking the leadership of the Leadership Conference, Wade was the Washington Bureau Chief of the NAACP, the National Association of the Advancement of Colored People. In that capacity, he directed the Government Affairs and National Legislative Program for the NAACP. And prior to that, Wade was Associate Director of the Washington National Office of the ACLU, where he began his career as legislative counsel and advocate on a wide range of civil rights and civil liberties issues. Wade also served as the Executive Director of CLEO, the Council on Legal Education Opportunity. Now, at the same time that Wade is leading the Leadership Conference, there's something, frankly, a little close to my heart. Wade has been and is the Joseph L. Rao Professor of Public Interest Law at the David A. Clark School of Law of the University of the District of Columbia. It's close to my heart for two reasons. I used to be Dean of the Law School when it was Antioch University, and Joseph Rao was a remarkable leader of civil rights. We brought him on the Board of Governors at Antioch, and Wade is now the Joseph L. Rao Professor of Public Interest Law. So please give a warm welcome to Wade Henderson.
Please. Thank you. No. Thank you very much. Thank you. Come on. Sit down, please. please, please, please. Thank you. Thank you all. And Ron, thank you for that very generous introduction. I really want to thank all of you for coming to a conference like this on a Saturday instead of being at home with your families and your friends. As for me, I feel that I am among friends, and maybe even among a kind of extended family. As you've just heard, I am the president of the Leadership Conference on Civil Rights, and many of you are members of organizations that are affiliated with the Leadership Conference. I'm proud to say that the sponsor of this incredible conference over the past several days, Families USA, is an important voice within the Leadership Conference. Many of you know how eloquent and indefatigable the Executive Director of Families USA, Ron Pollock, can be. At a meeting of the Leadership Conference Executive Committee about a year ago, Ron spoke passionately and persuasively about the need for the civil rights community to unite around the simple but powerful idea that health care is a fundamental civil right. That concept is at the core commitment of Families USA and the Health Action 2008 campaign. It is now one of the most important priorities of the Leadership Conference, and it is a central theme of this conference and a compelling idea that we will take away and carry forward from the inspiring and informative meetings that all of you have had over the past several days. We are all indebted to Families USA for convening this conference and to Ron Pollock for the great job that he does all year round. And while there are so many people whom I'd like to recognize personally, I do want to say a special word of thanks to Deborah Ness, the president of the National Partnership for Women and Families. Her leadership in the healthcare debate has been an important contribution to the work of the Leadership Conference. Together with Ron and Deborah, we've been able to galvanize the civil rights community to a new level of involvement in the debate over the nation's healthcare future. Now, why do we insist that health care is a national imperative and a civil rights issue? Well, let's look back 1 week ago, but also 40 years ago. Last Monday, the nation celebrated the Martin Luther King holiday. While many of the commemorations concentrate on his work against segregation in the southern states,